Dr. Danielle Kofler is a clinical and counseling psychologist and the founder of One Psychology Clinic.
With over a decade of experience across hospitals, universities, and private practice, she brings a grounded, insightful, and deeply human approach to therapy and mentorship.
She brings warmth, expertise, and a practical, evidence-based approach to supporting teens, young adults, and families.
In this episode, Dr. Kofler shares her inspiring journey from pursuing a non-traditional path into psychology to building her own successful clinic.
Get ready for an inspiring, thoughtful, and authentic conversation with Dr. Danielle Kofler.
Dr. Kofler, thank you so much for joining us on the Enriched Mindset Podcast.
Thank you for having me.
Yeah, maybe you can just tell our audience a little bit about yourself first.
Sure.
Yeah.
I'm a clinical and counseling psychologist. I've been in practice, doing therapy and assessment for over 10 years. This last May, I opened my own clinic called One Psychology Clinic in Midtown Toronto, where we provide services to teens, young adults especially, and their families. And I'm really excited to share about my journey with you guys here today.
Awesome.
Thank you.
Now, we got acquainted because you were running a workshop for students interested in either clinical psychology, psychotherapy, other mental health professions. I really appreciate that motivation you have to give back to students. And I think that's really one of our missions at Enriched Mindset, to try and help students clarify their career options. And obviously, a lot of things have changed with the College of Psychologists as we're filming this, and maybe we'll touch on that a little bit later. But maybe you can just start by telling our audience how you became interested in psychology in the first place.
Sure.
Yeah.
And just like yourself, I'm passionate about helping young students trying to figure out their way. It is such a lengthy, arduous, at times abstract process to become a psychologist, even if the landscape is changing as we speak. And so I think as mentors in the field, it's sort of up to us to guide that next generation. So I'm happy to be here and to share that. My story, it's an interesting one. I always grew up fascinated by the human mind, trying to figure out why people did what they did or thought or felt the way that they did. Always interested in humanistics, reading about, it was very challenging and interesting for an 8-year-old to read about like brain disorders books. But that was sort of what fascinated me. But things kind of changed for me. I immigrated to Canada when I was 16. And I didn't really know English back then. So that was quite the challenge to integrate into high school. And so I sort of had to leave the humanistics aside because my literature or English skills were just not up to par, and so I had to switch gears, and I attended Waterloo University for undergrad, and I majored in health science. Definitely not my strongest suits. The happiest day of my life is the day I finished Chem 101, no lie. And so I went through the motions of doing the science degree, and as I was going through classes, and we did have to take Psych 101, as most science majors do, and I was like, oh, this stuff is interesting and kind of reminds me of past me, was really into that stuff. And so I just took more and more psychology courses. I did graduate with a Bachelor of Science. And so I took a couple years off from school just to kind of travel, figure out what I wanted to do, the gap year or two. And then I read about clinical psychology, and I thought, oh, it would be amazing to talk to people all day and get paid too. So I don't know if you know, but when you go to the major clinical psychology websites, the first requirement is a psychology undergrad.
Yeah.
And I thought, well, I have a science undergrad. That's so much better.
Wow.
And so I was like, well, at least equivalent. And so I prepared my applications that year, all my transcripts, letters, without a psych undergrad, and I got shortlisted, and I attended all of those interviews, and I was very upfront. I said, I'm here, I'm grateful, and I don't have a psych undergrad, but, I can take these courses throughout, not a biggie. And they were like, no, we have 800 other applicants who have a psych undergrad, so what we recommend is you go back to school and get your psychology equivalent.
Oh my God.
And at that point, I was at a crossroad because I was already 24. And, it feels like everyone has figured their stuff out. Everyone's moving forward, doing graduate programs, working. And I was just like, do I go for another year of undergrad school to make up these classes and reapply with no guarantee, of course, right? Because every year it's professor-based. And someone gave me a really good piece of advice. They said, first of all, don't play the comparison game. You'll get there when you get there. Second of all, what's 1 year compared to the rest of your life if you get to do the job that you really want and love? Mm-hmm. Take a risk. And I said, okay, sign me up. So I did a year at York, humbling experience to be 24 taking these classes with 18-year-olds. But definitely, definitely worked to my advantage because I was so goal-oriented. Yeah. Reapplied, got a few offers, and decided to attend my master's at OISE at the University of Toronto. So not quite the straightforward journey that I feel some people might have, but I'm so grateful for that experience. Mm-hmm. I think that health science background has served me really well, and just having that very biopsychosocial model of clients in the field. That sometimes things are not so easy, and that's still okay.
You talked about getting shortlisted. So what does that mean? Like, you're on a list of potential interviewees? Were you interviewed, or when you got that feedback to do your psych degree, how did that come about exactly?
Sure. So the first time I applied, I actually applied to child psychology programs. Okay. And so that one in particular was York's child developmental psychology program. And so what happens, and similar at York and other places too, they'll have a short list of potential matches or students that are, a good fit. And then at York, they invited us to this luncheon. And so you're sitting at a table with a professor and maybe 3 or 4 of you who are basically all competing for that one spot.
Oh my God.
That's so intense.
Quite the dynamic. And then you meet the lab, the other graduate students who I actually think have a lot of say in who they admit into the lab. And then you obviously have your interview with the psychologist, and that's where, I made my case and I was told that. Other places might not. So for OISE, for example, I know internally they have a short list, but then each professor kind of contacts students for a one-on-one interview.
But there must have been something about your application that intrigued them to even bring you in to tell you that, because I would think maybe they wouldn't have even bothered to do that. Do you think there was something that made you stand out at that point?
I think so. I would hope so. And I was also saying that in the info session, I think that I had really good grades.
I was just going to say that. I was like, when we saw in the workshop, when you showed your transcript, we were all like, oh my gosh. And you're like, good, grades do matter. Clearly.
I really think so. They are just a really quick schema for what a person is, for their abilities, for their commitment, for their dedication, right? When you see a really stellar it's just one piece of evidence. Okay, this is a hardworking, hopefully, person.
Yes.
And so I think the good grades opened the door for me. I will say, and I shared that as well, my statement did not speak about research. It did not speak about potential supervisors. I really winged it because I didn't know anyone else who was applying. And I had no guidance whatsoever on what a statement should look like. And so I just wrote from my heart. I wrote my story, how I came to be. I wrote, why I'm making up these classes. And I think I made a killer kind of story that intrigued people. And so I made it through the door. And then, again, I fully respect that. And if I were in their position, I would want the same. Because when you accept someone into your lab, you want them to be super laser focused on the research being done. You don't want them to be, sidetracked with completing undergrad courses, right? Makes total sense.
Yeah.
Okay.
Wow. So you've trained in so many different settings, such as hospitals, universities, community mental health, and private practice. Which of those experiences most shaped your clinical identity?
Yeah, it's a great question. And I feel so privileged that I got to practice in all of these different settings and really get a flavor. I think all of them shaped me wherever I was at in my training. One thing I will say, I'm very grateful for my time at KMAH, the Center for Addiction and Mental Health downtown Toronto. That's where I did my pre-doc residency. I will say halfway through, COVID hit, so we had to pivot too. But what I really appreciated about that experience, I worked at the Work Stress and Health, where we see a lot of trauma WSAB cases.
Okay.
And then my other rotation was with psychosis and related disorders. So half of it was CBT for psychosis, and half of it was concurrent disorders, so substance-induced psychosis, typically first cases. It just, when you see the gamut and the complexity of those presenting cases, especially on the inpatient unit, in the day programs, right, forensic clients, it just gives you a really wide breadth of experience. Because when you think about just counseling centers or private practice, a lot of the time we see those, living well, quote unquote. And so just having that really anchored my practice to see, okay, this is the wide experience of mental health that you wouldn't otherwise see unless you practice in a mental health institution such as CAMH.
Yeah. And then walk us through your journey. So you have these experiences at these large institutions, and then I guess you go into join a private practice, right?
Yeah, I joined the private practice while I was doing my PhD. Just as a side hustle. Graduate school is a long journey, and we want to support ourselves throughout, which I know you also talk about, right? How do we support ourselves, throughout this journey? And so I actually practiced at Toronto Psychology Wellness Group. They were the first to take me on. It was such a lovely experience, and I practiced there up until I opened my own. And so throughout, I would take breaks, obviously, mat leaves, etc., but that was my anchor.
Yeah. And talk to us about how you got that position. Like, what was the position? What did you do? How did you get it while you were studying?
Someone I had gone to graduate school with, who was a couple of years ahead of me, she actually was one of my student supervisors at when I was at Princess Margaret. And so I asked her, do you know anyone who's hiring? And she said, yes, absolutely. These two Oise grads just opened their practice, reach out to them. So I reached out and I said, hey, this is me. This is my transcript.
Nudge, nudge. Hey.
Plus resume. If you have any opportunities. And we met and we moved forward. And I will say a very similar process happened in my own practice, where I reached out to recent Oise graduates and students. And I said, do you know of any doctoral students who are looking for opportunities? And so I just think word of mouth and referrals by people that you know and trust goes a long way. But I will also say, if I today received, a cold email, I would absolutely entertain it. And so I do encourage that.
And were you functioning like as a psychometrist, a supervised therapist? Like, what did you do there?
Yeah, I was a supervised therapist, and so I was working under their license. And, the one thing I said I would never treat is eating disorders. But then I had my bariatric experience, which is one side of the, this is more binge eating, emotional eating, night eating, etc. And then I met Nina and Michelle at TPWG, and their area of expertise is eating disorder.
Right.
But, and you can see that throughout my varied experience, my thing was always looking for supervision and learning from people. I was less focused on the population or the presenting issue at hand. And so I came with an open mind. I said, okay, I'll give this a go. And I ended up working in the eating disorder realm for 8 years, along with their intensive DBT-informed practice. So we would run skills groups, teens and adults, parent coaching if needed, individual therapy, of course, using diary cards, etc.
Right. It's really interesting. A lot of people are so focused on maybe following a passion in terms of a particular industry or discipline, but it might be more important to have good supervisors or good mentorship. Has that kind of been your experience? Because you've done so many different things, right? And you just mentioned eating disorders is something you didn't want to do.
Right.
Is that something you found to be true?
I mean, now in my own private practice, I'm not seeing as many eating disorder clients just because I do believe they need quite the system, which, for example, TPWG have.
Right.
And so I see less of those clients these days. I think there's pros and cons to both being more generalized, like I have done, versus more niche. I think in
Right.
terms of marketing and just building a name and reputation, being niche is probably the way to go. But personally, and I've struggled with this, I get easily bored. And so as soon as I go really in depth into something, I'm like, okay, what's next? And so I do know that's something that I try to work on, just to have that patience and stick around and realize that you become an expert in something when you put a lot of hours into
Right.
a particular field. And so it's kind of like you don't want to be too niche and not do anything else, I feel, but also being really generalized has its own cons as well.
Right. Yeah.
Okay, so now we're going to start going into more of like One Psychology Clinic. So starting your own clinic is a huge milestone. What inspired you to create One Psychology Clinic, and how did you know the time was right for you?
Excellent question. I always wanted to be in private practice, which is why I sought out that experience back in my doctorate. And I feel very privileged to have been in a clinic where I got to see its growth. You know, when I joined, I was their very first clinician. I think they now have almost 50 clinicians, right? So just to be a part of that progress and see their mentorship and how they navigated that really big ship afforded me a lot of those skills that I'm really grateful for now as a practice owner. What motivated me? I wanted my own autonomy and freedom.
Yeah.
And every place you work at has a set of values, right? The vision, those things are super, super important. And at some point I realized for me, I'm willing to work really hard in order to have freedom and flexibility, which if you're working for someone else, you might not always have because you have to align with that organization, which is great. I think there's some stability in working for other people, be it private practice or hospital or post-secondary. I was willing to forgo that to have my own say and kind of instill my own values into a place and bring on board people who would hopefully share that same belief set. In terms of timing, I did wait a couple of years while I was in autonomous practice. I do see a lot of new therapists coming in and establishing practices, and while I think it's great they're taking the initiative, I didn't feel quite ready. I just wanted to feel quite confident in my ability to navigate tricky cases, ethical dilemmas, just problem-solving things that arise, and at the same time consider financial obligations, family planning. My kids were 6 and 2 at the time, and I felt, okay, I'm out of the newborn trenches. I can take on a third baby, which is my clinic.
What's the best and worst thing about running your own practice?
The worst part of running your own clinic is there's nowhere to hide. You can't say, this is a clinic policy. No, I made that policy, right? I have to adhere to it. And the best and worst, I would say, I feel it's a reflection of me. Right? Even when I took a space at Yonge and Lawrence and I renovated it, every single piece I put into the place, every font I put on a flyer, every policy, I put my stuff into it. And so it can feel a little bit vulnerable, right? When people walk into my clinic, it's like they're walking into my second home.
Yeah.
Yes.
A lot of people that I know feel scared or intimidated to start their own practice. Do you have any advice for people who feel anxious? And is it for everybody? Maybe it's not for everyone.
It's a great question. I agree with you, Dr. Lee. I don't think it's for everyone, and that's totally okay, right?
Yeah.
Just the same way I was talking about values before, some of my colleagues really love the benefits, the EI, the mat leave, the vacation that comes with working for a different organization. You do your 9 to 5 and you get to go home. My job doesn't stop after 5, right? You have to put out fires, emails. I still work some evenings, right? It's more intensive that way. But again, for me, looking at my goals in life and my values, I that was kind of the right path for me. In terms of advice, talk to a lot of people, get a lot of guidance, because we go to grad school and the assumption is, okay, the client is at the door. How do we take them to the room and get started? But no one teaches us, well, how do I get that client at the door?
Yeah,
right?
that's
Which
right.
is the at the end of the day, a private practice is a business.
Yeah.
And we want it to be a profitable one.
Yeah.
I argue that, a profitable psychologist is a great psychologist because we don't have to worry about the day-to-day. We can put all of our stock into the work we do.
Yeah.
And so I didn't do an MBA or, spent my time learning Chem 101. And so I had the wisdom to go to other people and ask for advice and their support. So I have a lawyer, I have a bookkeeper, I have a consultant, right? All of these people who are helping me navigate the business aspect.
Yeah, and when I was in grad school, our grad organization tried to organize a speaker that could talk to us about setting up a private practice, and our clinical faculty rejected it, saying it was unethical to talk about business. And when you start out, you don't know about things like incorporating your practice, having a privacy policy, all the accounting and admin, payroll, all this stuff. You kind of have to learn either on your own or asking people. And I guess you were able to get some of these experiences in your actual work before you started, right?
Yes,
Yeah.
I did have it, but again, you don't really know what goes on behind the scenes until you walk the walk yourself and you realize, wow, this is a lot of work.
Yeah.
And just doing a lot of research, and I would consult with other psychologists. I think sometimes we feel like solo practitioners, or there's just so much competition in graduate school. But just the same way I reached out to you, I would want psychologists to collaborate a little bit more and help each other out.
Yeah.
Okay, perfect.
Yeah.
Your clinic emphasizes real talk and practical tools. How do you translate that philosophy in your day-to-day client care?
I think anyone who gets to know me, of course, we all have different masks. We're not the same person as we are with our partner or with our friends or with our clients. But you sort of want to have this overlap of who you are authentically.
Yes.
And I think for me, it's showing up as I am. I'm not a particularly formal person. I rejected a lot of psychology's elitists. I don't know. There's a lot of theory talk that can feel a bit jargony to most people who don't go to graduate school. And so my thinking was, how can I teach these concepts? How can I make this relevant for my clients and meet them where they're at? And so for me, that means using their language when I explain certain concepts. And so if they swear, I will swear too, right? We wanna build rapport. I will use analogies from their life, or I will just generally use a lot of analogies because I think it can be a visual representation of a lot of the concepts. And so I'm trying to break down these seemingly high-level theoretical concepts to applied skills that people can take and then use in their day-to-day. So that's what it looks like for me.
Oh, thank you.
Yeah, I think a lot of people are turning to social media influencers who don't have credentials because they're relatable. And I think what you're speaking about really resonates because this was talked about at the APA conference that I was at. They were talking about social media and how dangerous it can be, but at the same time, the fact that psychologists were not really out there kind of connecting with people in a real way. And it's good to know that you're doing that in your practice. You're the way that you're relating to them helps them get more engaged, I'm assuming, with therapy.
For sure.
Yeah.
And I love that you brought up social media too, because I think that's the sphere where a lot of the public is receiving information now. It's not going to their psychologist or reading even a book. It's more these small bites. And it's kind of a shame that, and I understand why, because when you go through the graduate program and you register with a college, there's a lot of fear-mongering, right, about how to promote yourself, because we have so many ethical rules and regulations, right, about that. And social media is this gray area, right? You want to have a presence, but are you an influencer? Are you a content creator? Can you share certain things or not? And then you see folks who are not registered, they don't have to abide by that set of policies. So they're just steamrolling ahead with information that may or may not be accurate or evidence-based. And then the people, psychologists, other registered clinicians who actually have the ability to share, evidence-based information feel really shackled and unable to do so.
Yeah.
Right?
And do you think things will evolve or change? Like, where do you see things going in our profession there in that context?
Yeah, I do see trends now of surgeons, obstetricians, family doctors now having more and more of an online presence on Instagram and TikTok. LinkedIn is kind of a whole other area.
Yeah.
Right.
And so I am seeing more of my colleagues have a presence online. Still think it's tricky to know what to share and what not, because the line between professional and personal can get blurry really quickly. And again, if I wasn't seeing clients, I think I would be more open to sharing more about my personal life. But because I have so much direct client care, my privacy and my boundaries are really important.
Yeah.
But what do people want to know? They want to know the day in your life. They want to know what products you use, what books are you going to recommend, if you had a fight with your partner last night, right? That's the stuff that we are curious about as humans.
Yeah.
So how do we find that middle path? I haven't figured that out
Yeah.
yet.
Yeah, for sure.
Well, I went on your Instagram and I saw, I guess you had like a day where you were renovating your space. That was really aesthetic and cool. Like,
Yeah.
Yeah, I think something like that is like very relatable. But yeah, you're right. It's hard to know how much you're going to reveal and what's appropriate. And you kind of don't want to be that case that kind of like is the example. But there's been some crazy stuff. I don't know if you heard like some surgeons are like live streaming and like on like rollerblades and like not paying attention, and they got in big trouble for that. Anyway.
Right, but that's the thing. It's social media is going to actually reward that type of behavior.
Outrageous behavior,
Yeah, they want the clickbaits. They
Right.
want the stuff that's going to create an emotional experience, right? Because most of the time, you don't get to see the day in the life of your obstetrician or your psychologist.
Yeah.
That's part of the professional boundary. And so you suddenly get a glimpse.
Right.
Of course, we're going to want to look through,
Right.
right? But then you ask yourself, aren't those boundaries there for a reason?
Right.
Right?
Yeah.
And so pros and cons.
So this is just something more for like students. What do you think universities could be doing differently to support students' mental health in practical ways?
Great question. I think in recent years I have seen changes being implemented, more mental health resources. The problem was not a lot of people knew about it.
Yes.
And so I think universities can probably, like most other spaces, do a better job at promoting these services, reducing stigma.
Are you noticing that maybe younger generations might be either less resilient or having more difficulty bouncing back from challenges? Is there something that younger people are going through that's different from like older generations? Because I think we're noticing that they're under higher levels of stress than previous generations. And then you have the observation from older generations that they're not as tough or they're not as resilient.
Yeah. I think that's the old kind of, we had it tougher back in my day. I walked uphill both ways to school. You guys have it easy now. I don't think people necessarily have to go through adversity. I think if you're alive long enough, you're going to experience some sort of pain, physical, emotional. It's more about, are we empowering and giving teens and young adults the tools to cope? And I think this is where some of the parenting, we went from like that really neglectful / harsh parenting of the 80s and 90s to overprotective, everyone gets a medal. And I think we just swung too much in the other direction. And when I work with parents, I tell them it's not about reducing the load. It's about how do we help your kid have a stronger back, right? Because when you reduce the load, when you say, oh, you don't have to do that, that's fine. We'll figure it out. We'll make it go away for you. Yeah, you're helping them in the moment, but in the long run, you're instilling this belief that you actually don't trust them to cope, right? And that, when I hear parents say, oh, I just want my kids to be happy, I'm like, that's not a necessary viable goal, because an emotion is never a goal, right? It's an indirect byproduct of a behavior. But what does that mean? That we don't trust our kids to get through when they're feeling disappointed, when they don't get the, soccer thing that they wanted, or when they feel anxious about an upcoming test or upset that they didn't do well. These are parts of life. And so what happens, I see teens or young adults who feel those emotions, because we all do, but then feel quite lost. What do I do when I feel sad?
Yeah.
And that's where I think as a society, we can do better to equip these young teens and adults to cope. But no, I don't think they're less resilient. I think we just did some, good intention disservice. Yeah.
That's a great answer. I can see that being a highlight of this podcast.
You just tell. Okay, so obviously we heard about your workshop and we attended. What inspired you to start offering workshops for students and organizations? When did that idea come up for you?
I've always been irritated by the fact that in psychology, we really don't have much offering. Right? When you go to a store, you have the cheap stuff and the middle stuff and the high-end stuff. When you go to a photographer, you have their small package, medium package, large package. Psychology, it's mostly that really expensive one-on-one package. Sometimes we have some groups, some sliding scale. But really, it's not accessible. And so my idea was to have these workshops one time, skill-based, topic-based talk to bring some skills to people who are super, super focused on this one problem and they just want support with, I don't know, just the same way, how do I declutter my home in 2 hours? Or what are some go-to strategies to reduce mindless eating, right? These very super specific topics. I just thought it would be a way to make mental health more accessible and to use our skills, again, in that bite size. And I will say, I listen to my clients. And so the things that I hear come up over and over, and I have a number of clients who are interested in going into the field. And I said, okay, there's a need here, right? I wish I could have the capacity to do research, market research, or to kind of see what exactly is the trend. But I just have my ear to the ground, whether it's on social media or through my clients or these conversations, and kind of see where's the wind blowing, what's the need right now in the market, and try and pivot and, adapt to that.
Thank you. I think that's such a great resource for students, especially people who are still trying to figure out, do they want to go into clinical? Do they want to stay in a different route of psychology? Especially when you showed the raw stuff, you were I'm very open to showing this, your transcript and what you did. And I think that's a really great way for students to see the real stuff. And instead of it just being you read something on Google and it's you need this, it's not that detailed. Whereas these workshops, they give you that detail. And that's, I feel a great thing for students. So thank you. We really appreciate that. I think it's a really great thing. I think both of what you guys do, especially when it comes to information for students, it's so helpful. It makes you become more sure of what you want to do with your life. And there's that guarantee, okay, this is possible for me. I can actually see myself doing this, and it's grabbable. It's not something that could be impossible. So I really like that. Thank you.
I appreciate that. You read the program descriptions on the website, and that's the ideal, right?
Yes.
But you want the real life, what does it actually look like? And not to scare people off, but more just have an honest conversation about, these are the pros, these are the cons. And I will say at the same time, I want young people to be optimistic, right? Not to be scared, because sometimes I'll talk to someone and I take them through the journey and then they say, no, I can't possibly do that. It's too much school, it's too much. And I say, everything in life, time will pass, right? It's what are your goals and values? And if that goal is worthy, then the journey will make sense for you.
Yes.
Right? And this is where the more you know yourself, the more sure, hopefully, you are when you're choosing a career. But any decision in life, it's never going to feel just right. And honestly, if I knew exactly what I was getting into, I'm not sure I would have. So there's so blissful ignorance along the way that even if you think you know exactly what you're walking into, there are always going to be surprises, even as we're dealing with the college changes these days, right? We didn't know. And you sort of have to say acceptance versus change. I accept, all the things that are kind of done for me, and then you focus on what is within my control in this situation, right? And it's the same with any other decision in life. And so if I can provide enough information so people can make an informed decision, whether it's about how to declutter their home or what career path they want to take, then I feel like I've done my piece.
Yeah.
Maybe we can touch briefly on these changes with the college. I mean, so you just did this workshop talking about, what are the requirements are, and now they've been proposed to be shifted. Can you talk a little bit about some of the changes that have been proposed?
I will do my best. As this is an evolving situation, I am in no way an expert. I think some of our esteemed colleagues are taking the reins and doing amazing work in terms of leadership. The Ontario Psychological Association in particular, and just the grassroots.
Yeah.
The Ministry of Health has proposed, alongside with the College of Psychologists and Behavioral Analysts of Ontario, they changed our name, to, in essence, try and increase access to psychology in the province of Ontario, as well as have mobility between the provinces. So currently in Canada, each province and territory governs their own psychology registration. And so, for example, in Alberta, you need a master's degree. In Ontario, up until now, you needed a doctorate degree or a master's and 4 years of supervised work to kind of be an equivalent to the doctorate.
Yes.
And for folks who don't know, to become a psychologist in Ontario, up until now, you needed that undergrad or equivalent in psychology, and then a master's where you do a practicum and a dissertation, and then a doctorate where I did like 4 free non-paid practicas, plus a year of predoctoral residency and a dissertation. Once you do that, you register with the college for a year and a bit of supervised practice, during which you write 3 licensing exams, one in general psychology, one in ethics, and then the last one being an oral exam where you're being tested by the college. And so that was the status quo up until 2 weeks ago. In order to increase, access to psychology, they proposed reducing to a master's level only, so kind of that lowest common denominator. Let's just have all psychologists have a master's plus only 1 year of that supervised practice. So you would be getting rid of that doctorate degree. You would be getting rid of all of those free hours of labor that I provided, and my colleagues did too. Yeah. And then they said, that ethics exam, we'll just make it a non-fail or pass online module. That EPPP exam, which is that generalized knowledge, you can take as many times as you want until you pass, which I don't know why one would want to do that. It's pretty harrowing. And then that oral exam, no, we don't need it. You're good. And so obviously that got a lot of psychologists who are currently practicing in a roar. And I will say it's not about the master's versus PhD level, because up until now there are plenty of master's levels, trained psychologists, my colleagues who I worked with, who I have in my clinic. It was more about getting rid of that 4 years of supervised practice. Our worry as a collective, I think, is, are we going to be allowing psychologists with just a master's with 1 practica, which is 500 hours with a minimum of 150 client hours?
Right.
Meaning someone could be seeing 5 clients. That's what I did for my first master's practicum at the Oise Clinic. That was about it. How are we going to cram all that knowledge for assessment, diagnosis, therapy, ethics in those 2 years, plus a year of supervised practice, and not be tested on these things?
Yeah. And, I had to get licensed with a specific population and area. I believe they're trying to get rid of that. It's kind of interesting that someone could have no experience with children and then suddenly be able to practice child psychology or forensic psychology.
Or couples or seniors or educational.
There's like an overabundance of psychotherapists with a lot of these schools now, online schools, and people get their masters through that.
Yeah.
So then I think one of the concerns is that the psychology market will suddenly be flooded by people who might not have the training. Are there any solutions in your mind that are alternatives that could, I guess, try and achieve the goal of increasing access in your mind?
For sure. As I mentioned, I think the goal is a noble one, to increase access to highly trained psychologists. The recent surge of online schools, one at which I briefly taught, just to get the inside scoop, and wasn't a pretty one. They're pumping out about 1,500 new registered psychotherapists per year. And so in terms of psychotherapy, the market is saturated. I think they were looking to increase more diagnosis and assessment, but again, how are we going to do that with minimal training and minimal supervision? There is a risk to misdiagnosis and the potential harm of that. And so, like yourself, I can't predict the future. I think it's pretty much a done deal in terms of, removing the doctorate, but can we argue for still having that increased supervision?
Right.
That's really the crux of it, to make sure that people are ready to take on that autonomous practice, because you have a duty to do no harm and to be effective. And the whole point of the college is to protect the public from harm. Yeah, we're not brain surgeons, but we do custody assessments.
Yeah.
People's children's lives are affected. We do forensic assessment.
Yeah.
People's freedoms depend on that. I do psychodiagnostic assessments, so I decide whether someone goes on short-term disability or receives accommodations at school.
Right.
And just therapy in and of itself, the amount of times I've heard people not having a great experience with the therapist, that ranges from invalidating to re-traumatizing, and having to undo that work and regain that trust. And so I hope that if we are going with that master's level, that we continue with the supervised practice element, or at least have some stops along the way to evaluate. I think it will put a lot of the onus on supervisors, but I'm willing to do that if it helps protect the public.
Yeah. And I think there's actually so many qualified people who apply for clinical psychology, and because there's so few spots, there's like this untapped potential there. And people who are getting in maybe in the third, fourth cycle, they probably have been always qualified. The timing didn't work. I think trying to find ways to increase the cohorts, or introducing more PsyD programs in Canada might help.
Okay, so the props or the flags, but we're doing like a never have I ever segment. Okay. So basically, green means I have.
Okay.
And then red means never. So I've never done it. Okay. So we'll start with the first one. Okay. So never have I ever had an aha moment in the shower that solved a work problem. This could be like anything in general.
Yeah, I think so.
I feel like the shower is where you have your most like random thoughts.
Sure. And I think, clients wonder, seeing this a lot in social media, like, do you think about me between sessions? And the truth is, absolutely. Absolutely. We think about our clients, and after a heavy, difficult session, it's still replaying. What should I have done differently? Do I need to do anything now? Do I need to consult, right? So I think the shower is one of those moments. And it's funny because I think, I talk about mindfulness sometimes, and I don't know if that's ever happened to you, but sometimes I'm like, thinking about my day, and then I'm like, did I actually wash my hair? Right? Because I wasn't mindful. I was in my head kind of thinking about the day.
You totally forgot.
And I'm just like, I'm not sure. And it's incredible how we operate on automatic pilot, and our body can do things that we're just so not aware of.
Exactly.
So yeah, probably too guilty of that, and trying to be more mindful when, I do my day-to-day activities.
That's hilarious. Okay. So never have I ever had to pivot mid-session when a therapy technique wasn't working.
I feel like I've done all of these.
It's going to be a lot of green flags.
Yeah, for sure, which is good. Yeah, absolutely. I think part of, a great clinician is one that's attuned to the client, not only with what they're saying, but also the body language, right? If I'm going in one way and I'm seeing they're closed off, they're not engaged, I will absolutely abandon, and I will verbalize this. I'll say, okay, let's shift gears here. I see my plan for the day isn't going to work. Let's do something different. I'll have people, for example, with teens who sometimes are hard to engage, especially if they don't want to be there. I have a lot of games in my clinic. I just say, okay, let's go off the couch, sit on the floor, color, do a game of Spot It, just to kind of do something different, because if you're trying to do the same thing and you're not getting a result, it's just not working.
Yes.
So absolutely, I think it's great to adapt and shift, even mid-sesh.
Okay, so never have I ever learned more about a psychology topic from pop culture, like a TV show or a podcast.
Yeah. Why not? Why not?
Is there like any specific TV show that you like?
I loved watching Shrinking. It's like a Ted Lasso vibe, right? It's kind of sad, but nice, post-traumatic growth, all of that. And so Harrison Ford teaches this young girl who lost her mom about like 15 minutes grieving time. They just set a timer, and it's kind of like CBT worry time, right? Like, let's set a worry time. And it's like, this is my time to like listen to my music and cry, and then it's over, and I go back to life. And I thought, oh, that's a really cool concept. Again, obviously so connected.
Yeah.
The other one that I have a bit more beef with is Mel Robbins' Let Them
The
Theory.
Let Them Theory? Yeah, okay. This will be interesting.
Am I
Yeah.
stepping on toes? I mean, great podcast. I love what she's doing. She's putting out to the masses, right? All of these, simple concepts. If you think about it, they're rooted in DBT. They're rooted in ACT, right? Of how to accept. If you think about it, let them is like radical acceptance. I just have to accept people as they are. And then the change piece of ACT is let me, what do I have control over? How do I want to react, right? So my beef with her, A, was that she didn't really make the connections of where these concepts came from. And B, the oversimplification of it.
Right.
Because I think, and I did comment on one of her videos a while ago, and my intern can corroborate that they woke up to like hundreds of likes and comments.
Oh my God.
All I wrote was, she posted this, 10 ways to have a great day. And it's like, exercise, be in the sunshine, to like better mental health. And I said, that's great, and I love that. And at the same time, put so much pressure on the individual themselves. You go exercise. Well, you need time to exercise. If people are working 2-3 jobs, right? That might not be the best way for them to improve their mental health. And so part of meeting people where they're at is to say, and this is where, again, I have some trouble with CBT because it's like cookie cutter, this is what you do. But it doesn't really take the individual into consideration, puts a lot of emphasis on them. And then if someone's struggling, they can then say, well, I'm not doing enough, right?
Yeah.
Or I'm failing. Versus saying, for me, and I'm sure there's a question there about it, like, I watch trashy reality TV show. That's amazing for my mental health, and it would be horrible for someone else's mental health. Okay? Just the same way exercise is great for some people. Some people don't want to do that.
Yeah.
That's fine. That's where my trouble is. And it's the trouble with social media as a whole, right?
Yeah.
It's taking these small things and reducing them to clickbait and very black and white. This is what you do. 3 tips to do today to get rid of your anxiety forever.
Like,
You're going to be like, yes, I want that. Of course you're going to want that.
Right.
It lights our dopamine like crazy. But how relevant is it to you? How true is that?
Yeah.
I mean, the whole point with CBT is we want to come to a middle path.
Right.
Where these things are a bit black and white.
Yeah.
But she's great in other ways.
yeah.
What do you guys think about that?
I see what you mean for sure. I mean, her book came out too, like the Let Them Theory. Like she actually made the book, but I remember seeing the TikTok like I think it was like a couple years ago. I saw it. It was on my timeline, and I did like it. I was like, okay, yeah, this is something I could use. So I found myself saying, oh, just like let it be. Like I'm not gonna die on this hill. There's no worth. Like this is not worth fighting for. But I totally get what you mean when it comes to that specific TikTok. If I saw that, or like the video you saw where it was like, oh, exercise, do this. I am the type of person where if I see something, I feel like, oh my God, I'm so behind. Like I need to do this. Like now I feel like I'm not enough or I'm not doing enough. And I'm like, oh my gosh, I'm so behind. I need to do this and that. But for the Let Them Theory, I did use it in my everyday for a little bit, and it was kind of helpful because it does like make it a bit easier when you're going through something. But I don't know too much on her. I don't go too much into her stuff.
Yeah. I mean, I can see that theory being useful for someone who has problems with setting boundaries or maybe too attached. I can see it being not the greatest advice for every situation, or someone with like an avoidance personality style, et cetera.
For sure.
Yeah.
Such important, limitations to acknowledge. And again, I think, when you think about different theories, CBT, DBT, all of this stuff, they have more in common than they are different. We just put a different label on it, right? In DBT, it's radical acceptance. Let me radically accept reality as it is, right?
Yeah.
It's the same as let them. They want to do this. I don't like it. I let them. I'm, in essence, accepting that reality,
Yeah.
right? And in cognitive behavioral therapy, we'll say, well, that's a very, negative thought. How do I reframe it so I can walk away, right, with less heightened emotion? So again, I don't mind the repackaging of it. I would just want more of that little subtext of there's a bit more to it.
Right. Yeah, for sure.
Okay. Never have I ever bought a self-help book and never finished it.
So many.
It's okay. I'm the same way. I have like a stack that I just haven't gotten to yet.
You go to Indigo or another store and you're like, oh, I need some inspiration. You go to a self-help section and you're like, yes, this is the book, and you attach to it. I also read the Let Them. Did I finish it? No, but you just want that inspiration, right? And change and just new material. And so I don't think that's a bad thing necessarily, as long as you get what you wanted out of it.
Okay. So never have I ever worn pajamas during a virtual meeting while looking professional from the waist up. You've done? Okay. I didn't think you would. I don't know why. I'm like, you just seem so put together. I
would say
would.
not pajama. I do
sweats.
like sweats.
Okay, yeah.
Okay.
I do the same. Okay.
Right? Like, we want to be comfy, just the same way I would want my clients to be comfy, right? And again, I'm quite informal day to day. So yeah, absolutely. What's the benefit of Zoom, right?
Yeah, exactly.
I will say never in bed though, and I do encourage my clients not to attend from bed.
Yes.
And yeah.
That would be
that's my hard no.
Okay.
Yeah.
Okay, and last question here is, never have I ever doubted whether I chose the right career path, even if it was for a moment.
I told you, I've done these so sure. I think that's so human and so okay when things are challenging or uncertain, as they are now, to kind of have a little doubt, to say, if I've done something different. At the end of the day, I keep going back to my reality, and I'm so grateful that, past me so long ago chose this career path. Would I do some things differently? Maybe, but I go back to the here and now and what I have control over. So I'm really happy to be a psychologist.
Was there like anything else that you were kind of into? Like kind of like going back and forth? Was there another field that you were kind of thinking of before psychology?
That's a good idea. I mean, I've always wanted to be in healthcare or like a helping field. I did apply to teachers college, and then I realized not for me, or the child psychology, and then realized not for me. My whole thing with science, maybe med school, but now they're doing the prescription privileges, so I'm thinking of doing that. So
Right. Okay. Yeah.
that's where we're gonna go,
Get
I
there.
think, next.
Okay.
So we have our lovely website, onepsychology.ca. We're on Instagram, LinkedIn. I need to get more busy on that. I also have my own personal page, just that's a bit different from the clinic itself. It's a bit more personal about me, my journey, things like that hopefully will grow. So yeah, either Google onepsychology.ca or go to the website.
Great. Well, it was so lovely to have you on the podcast, and I hope we can collaborate more in the future.
I would love that. Thank you so much. It's been lovely.
Thank
Okay,
you so much.
thank you so much.